There are two kinds of students in the world. Here we have a student A who has been studying for over 8 hours and is on their 5th cup of coffee and has been highlighting the notes and has been rereading the textbook and doing flashcards mnemonic all night long. And here we have a student B has very calm 2-hour study session and they know exactly what to review, how to review it, and barely waste any time highlighting their notes or rereading the textbook. The student A thinks that how did he get such a good rank despite of studying only for 2 hours? That is what I am going to tell you. Hey everyone, this is Dr. Aishwarya Kanere, your very own guide and mentor. I am here to help you sail through any of your exams with ease. In this video, I am going to teach you how to study less and get higher grades. So I graduated as a doctor from a medical college and I have discovered, tried and tested many ways that help in effective studies. As you know that MBBS syllabus is vast and overwhelming, which requires us to stack up on a bunch of classes all at once. So as you can imagine, I had to be very efficient with my studies and the entire time I had to keep up my grades. So here are some of the study tips that help you ace the exam. The first tip is forget the hours. Disconnect yourself from the number of hours that you study. As a student, it's very easy to get fixated on the amount of time you spend studying instead of how you actually study. Get it right, because it's very hard to measure the effectiveness of a study session, but something like the amount of time you spend is very concrete measure, though it usually masks the true nature of the study session. Let's take an example. Suppose I study for 5 hours. Now, did I spend those 5 hours rereading my notes or highlighting everything I possibly could, or did I quiz myself? Or did I pretend to teach others? Tackle my weakest concepts first. First, those two behaviors will yield drastically different results. So now that you're in the right mindset, let's move to tip number 2. The tip number 2, read backwards. Now this tip sounds weird, but you will love the tip the most. It's valuable, especially if you are cramming for an exam in the last minute. So a night before the exam, you're probably tempted to pull out your textbook and read the chapter entirely. But there's a problem. The chapter is probably very long and you don't have enough time. So you're going to start at the end of the chapter at the summaries and the key points, and then too you're not going to read the chapter entirely, even when you have worked your way towards the beginning. What I like to do is the first pass. You're going to look at all the headings, all the charts, all the bullet terms and all the colorful boxes to get a high level understanding of what the chapter is all about. But of course you're still missing some of the key details. So now you're going to do the second pass. And no, you're not going to read the chapter normally. Instead, you're going to do section by section and read the first paragraph, skim the body paragraph and read the last paragraphs for keywords. Keywords are important boon in medical studies. Trust me, you can recollect the entire chapter just by knowing the keywords. The tip 3 is batch your tasks. There is a problem that a lot of students deal with, and maybe even you, which is something called as the context switching. So for example, the mindset that you have while reading something is different from the mindset while writing something, which is different from the mindset while solving questions. Switching from one form of thinking to another takes time, something I like to call as the context switching cost. So, for example, you have to solve a pharmacological equation, and on the other hand, after 1 hour, you have to write a long answer question on Guillain-Barré syndrome. Both of these tasks take different forms of thinking. So, to save time while studying, you have to use a technique which is called as batching, which means do the simpler tasks together and then difficult tasks together, or the related ones together. Like for example, studying pharmacology and pathology will help you to get a grip over medicine subject. This way you have less mental transitions, content mixing, So for example, if I read physiology from Guyton and Hall textbook, but I also read the same topic from A.K. Jain textbook, the mental transition increases for each topic and the content from neither can be memorized efficiently. So stick to one type of content. Both books are wonderfully written, but you need to know and search the book that suits your learning effectively. Give yourself constraints. This is tip number 4. So now the easiest way to spend less time studying is to give yourself less time to study. Yes, I am 100% serious. So there is an old law called as the Parkinson's law that works as work expands so as to fill the time available for its completion. So easily saying, how much ever time you give to a task, that much time you're going to take to complete it. So if you constrain yourself on I have 3 days, eventually you will work at a slower pace. So easily to make things work, set a timer before the task and you will get surprised by how fast you can finish your work. Remember, our competitive exams are also time bound, so practice makes everything perfect. Keep practicing time-bound mock tests so your chemicals in the brain know which pathways to take at the right time. Tip number 5. Use tools like flashcards, Google Calendar that help you to keep a check on your study content, important topics and your time and day of study as well. Tip number 6. Don't get stuck. So while you're working through an exam or doing an MCQ test, you're inevitably going to come across problems that stump you. Now here I am not talking about the problems that are a bit challenging. I am talking of the problems that you have no idea about. The thing that you have to do here is swallow your ego and move on. And this was a huge issue for me in MBBS. I would feel terrible if I moved on without figuring out the answer. But this ties into a psychological phenomena called as the sunk cost fallacy. It is a phenomenon whereby the person is reluctant to abandon a strategy or a course of action because they have heavily invested in it, even when it's clear that abandonment will be more beneficial. It means that if you have put all your efforts and time in solving a question that's going nowhere, does not mean that you need to waste even more time. Tip number 7. Do mindless tasks first. So there are two kinds of tasks. There is a fixed task and variable task. So in the fixed task, mindless work comes into picture where we use medical flashcards memorizing a long answer. In variable task, there is requirement of more mental energy, writing a mind map from a paragraph, memorizing Krebs cycle, pharmacological drug dosages. So you should do your fixed tasks first, and here's why. So if you do the variable task first, they are going to follow the Parkinson law. In other words, they are going to inflate and take up all your available time, and now you won't have time to fit in your fixed tasks. So this is the concept I've been following, and let me know how you feel about it in the comment section below. Read the important topics only before exam. Students waste a lot of time rereading notes. This is because the days leading up to the exam, we don't really know what to focus on. We just tell ourselves, oh my god, there is an exam prelim coming up. So for every subject, there are topics we know like the back of our hand, and there are topics we are not so familiar with. So if you want to spend less time studying, you have to spend less time on the topics that you are already comfortable with. And that is why marking keywords, studying the previous year questions becomes super important. The topics that you are not familiar with, just mark them with a different pen, highlight them, star mark them. This way, when it is time to review your notes, your eyes will automatically be drawn to the areas you need to focus on. So that wraps up today's video. Hopefully you enjoyed, and by the way, let me know how the medical school is going for you. Are you enjoying it? Is it tough? I would actually love to hear more from you guys. And of course, if you haven't already, be sure to subscribe to the channel for more study tips. Good luck. See you in the next video.